I thought it might be handy just to show perhaps the art of what is possible for some stuff with templates in EMIS, because I these are more complex templates to build, but perhaps can be more useful for quick consults and focusing the reviews. I'll show you perhaps a couple of example patients. So this is a 56-year-old, and this alerts box would normally sit at the bottom right of your screen. And actually, I've had to put it up here just to hide the patient's name, but this is the testing template. It's an amended one of my main template. If I was to open something like that up, what you'll see is perhaps how I would formulate some of the asthma templates. So you might, for example, want to make sure that you're really highlighting lack of pneumococcal, lack of flu vaccine, SABR's high, that on a combination, Beans do MART, more than 12 SABRs in the last year. But it's this sort of thing where we're looking at what is the diagnostic test this person's had. So this will highlight there's an eosinophil raise count in the past. And this thing of saying things like how many preventers in the past 6 months. 6 months, I'm afraid, is the thing that we can use when it comes to issues. If you want to count numbers of issues in the last month, but you can see, 5 preventers past month, but more than six SABRs, and no antibiotic, no pred courses. And then the other sort of things around, do you want the Royal College questions, which was the old QOF stuff, or links control test, links the asthma guideline, links the asthma hub, and links inhaler technique video, and your predicted peak flows, asthma plans, smoking. Pack years, we could build a calculator, although we probably just sort of pull that in and then review things. Some of the stuff like height, weight, blood pressure, they're sort of standard additional things I tend to put into mine. So if anybody needs their weight doing, then it comes as a separate box. It doesn't have to be just for asthma for that one. And so you'd have things like this person really eligible for a statin. We need their smoking status, their alcohol status, height, weight, blood pressure, all those sorts of things. I'll just show a couple more patients. So if I search for somebody that was no preventer and taking lots of Ventolin, because obviously that's quite a link with the increase of death, if I choose one of them, when I open the records, it'll tell me, listen, high Ventolin use, no preventer, please review. So you can have it sort of trigger for high risk concerns. And that warning will stay in the alerts box saying high Ventolin, no preventer. It talks about asthma, mental health. And then if I look at this testing template that I've drafted up, again, it'll have all these things in that review template. So again, picking up lack of vaccines, SABR use, no preventer, more than 4 Ventolin, links to the GINA, talking about increased risk of death. And then, yeah, you go down, he's on the asthma register, no coded diagnostic tests found. So if there's anything like Spiro, Pheno, eosinophil, reversibility, it would look for any of those things. And then again, this type of thing where it'll tell me this chap, no preventers the past 6 months, 5 SABRs, no antibiotics and steroids in the last year. And so you can have it sort of self-fill. Now, the way that would work is I would tick that if I want to enter that as part of my right. So if I save this now, when you look at the consultation, it'll say no, preventers issued, no preventers, SAB inhalers past 5. So that you've got this thing where it's free texted. It doesn't code that number as a code. We can do that and play with that if that's wanted. But it's showing that you can have these dynamic or these live templates built on concepts in background that can show you these things, so you're not having to actively search for them. You can also formulate a bunch of searches that would look for things like, hey, we shouldn't really have any COPD patients that are LAMA. We've got people with just steroids and 4 or more SABRs who should really be on a combination. And if I was to open an example of that one, we can highlight that we should be considering a DPI green inhaler there. So it's part of that initiative. And if I open up the template for this person, again, it's pointing out lack of pneumococcal, did have a flu vaccine 21, declined at 23, more than 4 SABRs a year. So it's got links to advice on MART regime, got links to nice decision support aids because he's got this, we can put him on a green inhaler. You can see that at least we've got this diagnostic test. He's raised the eosinophil in the past. You can't put a 0.03. It's to do with the way this works. And you can see, okay, he's not so bad. He's 1 prevent in the last 6 months, 1 SABR the last 6 months. So there's a sense here where, he's steroid alone. So he's just Clenil at the moment. And I guess you could discuss the pros and cons, but the fact that he's needed Sabatol, you could improve on that. And yeah, obviously you'll always get your previous readings on the right, placed on the left here for new, and things like some default follow-ups. I haven't put some of those things into the COPD template. They are in there, but just in a slightly different way. So if I was to choose one of these COPD steroid inhaler but no LAMA, and I go into their records again, you'd have these little alerts saying, COPD, lots of Ventolin, no LAMA. High Ventolin, COPD diagnosis. Do we need to look at mixed phenotype? You can't see when you hover over these. It'll give you some advice. Again, green inhaler. And if I open the testing template, it'll give you the same sort of things we've had with the others, but with a few extra bits and pieces thrown in. So Saba's high. He's already on a combination. Do we want to look at different regimes? We could look at green inhaler, COPD, no LAMA, 5 courses of PRED in the last year. It offers a Q frax whenever there's 3 courses of actually, we need to fix some of this. 5 antibiotics in the past year, and again, links to COPD and things like that, but also all the other stuff like not responding to bowel screening. These are health and well-being courses for chronic diseases that you're eligible for in that area. So I'll show you that. I quite like it. So you can send this to the patient and say book yourself in for your. There was one on COPD, I'm sure. Yeah, there you go. COPD self-management course and things like that. So there's lots of potential with the templates. So you can either have it like the old COPD one here, where you have a section that tells you how many antibiotics or steroids, or like the asthma one inside the thing, where it'll just give you a number. The advantage of that is you save it and it'll record it into the records for you. And I guess the only reason I'm showing this is that I think it's useful to know that there is this functionality. It does, however, make these templates slightly harder to import. You have to know how to do it. So if you do want to import a template that has these types of concepts attached, there are some videos on YouTube on how to do that. Ideally, what would happen over time is that we would get something called Resource Publisher. And what would happen then is that you would have a folder, so similar to this EMIS library folder, where you might have a folder for Wales templates, and we could automatically then have these templates available on all the systems in Wales. And you could do the same with the various prompts. So you could have these prompts switched on for all these various issues. If anybody's seen the work we've done for CKD, it's a very similar principle. I mean, that template's ready to go. You can have it. The only thing is it's written in Read and it's just been edited by me. I think it's the type of thing that would need a bit of validating, a bit of playing with. But I think it's very important to know that this sort of thing is possible.